Greetings. Let us talk about nasojejunal tube placement or NJ tube placement. These are my acknowledgements. And the learning objectives include the following. First is we will learn about the role of a feeding tube, in this case nasojejunal feeding tube or NJ tube, and how do we set it up and assist with the procedure. So when it comes to nasojejunal feeding tube setup, we need a few things. We need a guide wire, we need a lubricant, a little bit of saline syringe to flush and check the tube, and also an NJ tube that goes over a guide wire. So when the endoscopist says we'll put in a nasojejunal feeding tube, then the next step is to consider whether he's going to go through the mouth or whether he's going to go through the nose with the endoscope. If he's planning to go through the nose, then you need to pick a small caliber, 4.9 to 5 millimeter slim EGD scope that can go through the nose. As part of this procedure, it is important to work with the anesthetist and make sure that you find out which nostril is easier for the patient to breathe. Sometimes patients can have a deviated nasal septum and one nostril may be smaller and the other could be bigger. So pick up the bigger nostril. And the second is to consider anesthetizing the nostril with a local anesthetic. That is important for the sake of comfort to the patient. When it comes to placing a nasojejunal feeding tube using a slim EGD scope that goes down the nose, these are the steps. The endoscopist introduces the small slim scope, and when he's introducing, you will notice that he's passing the endoscope at the floor of the nostril, along the floor, so that he doesn't get stuck in any of the turbinae of the nose, and then goes into the pharynx, and from the pharynx to the esophagus, stomach, duodenum, and then as far down as the scope would allow, deep into the jejunum. The 5 millimeter scope is a little bit flimsy, so to give it a little bit of stiffness is probably not a bad idea to consider adding the stiffening wire if possible, but this will limit the suction. So once the endoscope is in the jejunum, proximal loops of the jejunum, you insert a guide wire. So before the guide wire is inserted, make sure you flush the guide wire while it's still in its casing, so as to moisten the guide wire. That is very important, to moisten the guide wire, because without moistening the guide wire, the endoscopist will struggle when he tries to pull the guide wire after placing the nasojejunal tube. So important to moisten the guide wire and make it wet. That's important to do that. So once the endoscope is in the jejunum, the endoscopist passes the guide wire into the jejunum, and then the next step is leave the guide wire in the jejunum and then pull the endoscope out as the guide wire is being fed. An experienced endoscopist who knows how to exchange the wire and the scope probably does not need a fluoroscopy, but for somebody who's starting fresh, it is probably a good idea to watch the tip of the guide wire under the fluoroscope periodically so as to make sure it doesn't slip out, and also make sure that he's not forming a big loop in the stomach. So these are the steps. So now we leave the wire in the jejunum, we withdraw the scope, and as the scope is coming out, the assistant should be ready to hold on to the wire and avoid the wire slipping out. So that is important to keep in mind. And before the nasojejunal feeding tube is slid over the wire, it is important to flush the channels of the nasojejunal feeding tube with water so that the tube can slid over the guide wire easily. So that's very important to do. And once that is done, as the catheter is coming closer to the nose, it's a good idea to lubricate the catheter so that it goes down over the wire, down the nose, pharynx, esophagus. And while this is happening, it's important that the wire is kept in place with a little bit of tension as the catheter is being slid down into the stomach, duodenum, and proximal loops of the jejunum. Once the endoscopist is happy with the placement of the nasojejunal feeding tube in the proximal loops of the jejunum, the guide wire is pulled out and the tube is secured to the nose. So, as you can see, as an assistant, the assistant should make sure that he flush the guide wire and keep the wire moist. And then when the tube is being given, again flush the tube and lubricate the tube as the tube is slid over the wire and it comes to the nose. And once you can see the wire at the other end of the tube, to secure the wire and keep a little bit of tension, not to pull it out, but a little bit of tension so that the catheter can be slid over that wire down the GI tract until it reaches the jejunum. So we've learned about how to place a nasojejunal feeding tube using a slim scope, maybe 4.9 or 5 millimeter scope, going through this nose. So if in case you don't have a slim scope, you can still put in a nasojejunal tube using a regular EGD scope. In this case, you follow the same path. You go down the mouth, pharynx, esophagus, stomach, duodenum, jejunum, and once you come to the jejunum, you leave the wire in the jejunum, withdraw the endoscope, and as the scope comes out, hold on to the wire and avoid slipping the wire. Now, the next step is to exchange the wire from the mouth to the nose. In this case, we pass a smaller catheter from the nose or a plastic tube from the nose through the pharynx and then pull it out from the mouth. So one end of the catheter is outside the nose and the other one is outside the mouth. And then we feed the wire into that catheter coming out of the mouth and then feed it until it goes through the catheter and then comes out to the other end where it is coming out of the nose. Once it comes out, you pull the catheter out of the nose while making sure the wire going down the esophagus doesn't slip, and then you remove the catheter, and now you have the wire rerouted. Instead of coming out of the mouth, it is rerouted from the esophagus, pharynx, nose, and coming out. And once you have done this, then the next step is making sure the wire is made wet with a wet gauze. Flush the nasojejunal feeding tube with saline and lubricate the end of the catheter as it is slid over the wire and it reaches the nose, and then keep the wire taut, and then continue to slide the catheter over the wire down the esophagus and then through the stomach, duodenum and jejunum. And once it's in the jejunum, we pull the guide wire out and then secure the tube to the nose. If the tube is placed under fluoroscopic control, you can confirm the placement immediately with a fluoroscopy shot. If the tube is placed without the fluoroscopy control, it's probably a good idea to arrange for an X-ray to be done to check the position of the tube. Usually, these feeding tubes are used for short-term feeding, lasting for a few days to maybe a couple of weeks. If it takes longer, more than a few weeks, then one should consider the placement of a percutaneous endoscopic gastrostomy tube. I hope this is useful. Thank you.